It may be a gloomy outlook for those looking for long-term care beds on the Sunshine Coast.
I felt like they weren't hearing me.
Something Evie Blewett,
They didn't believe me.
knows all too well.
I feel like for some reason the Sunshine Coast is being forgotten.
Blewett was the primary caretaker for her partner Ivan, who had cancer and Alzheimer's. She says it was more challenging than it needed to be.
I had 2 doctor's notes during that time where they said I am not really in a healthy enough state to be looking after somebody 24/7.
He was put on the list for a long-term care bed in 2023.
How would you describe your experience with Vancouver Coastal Health?
Bad. They're rude. They don't answer you. They don't seem to feel any sense of accountability to explain why we're not getting the help.
Data from the Office of the Seniors Advocate shows Vancouver Coastal Health's median wait time for long-term care is 231 days, a 250% increase from 2018. But Blewett says she waited longer.
And I needed help 2 years before that. And I was asking for it.
VCH says it understands the frustration for families, adding, quote, wait times can vary depending on several factors, including medical urgency, the number of people waiting, and other factors. The most recent census shows more than 1/3 of Gibson's and Sechilt's population is over the age of 65.
There's going to be a tsunami of older people needing the kind of help that I've needed.
After years of waiting, Ivan was placed at Silverstone Care Centre in Sechelt.
When he finally got into respite, the nurse said to me, "How did you do this by yourself?"
Vancouver Coastal Health says there are currently 204 long-term care beds on the lower Sunshine Coast. Now 40 people waiting for a bed are considered high need. The Seniors Advocate says currently there are more than 7,000 people on the wait list in BC, a 200% increase from 2016.
The Sunshine Coast is perhaps the epicenter of where this is happening.
And adds, this is a crisis.
And we're falling short. We need 50% more beds built in the next decade.
Something that local mayors say they've been trying to address.
I think it's bordering on inhumane the way we are not addressing this.
I'm calling on the provincial government to take action on addressing this long-term care gap.
In a statement, the health ministry says, in part, in the last 5 years, government has invested approximately $3.5 billion in primary care, home health, long-term care, assisted living, and respite services. But for longtime residents like Blewett, she still has questions.
Why aren't we getting better care? And I'm still here sitting wondering, because there's going to be a tsunami of older people needing the kind of help that I've needed.
Demetra Marigo, CTV News, Gibsons.